mother has 2 chronic conditions. I hold the Canada Research Chair in E-Health Innovation, and I also have a chair in supportive care. I do palliative medicine. And I'm struggling to deal with her challenges because I wasn't trained to deal with chronic problems. Most of my training was focused on acute conditions, things that we could fix. And I became a very good mechanic at dealing with bodies that break down. But when we are dealing with something that goes on for years, and my mother is facing at least 2 more decades and probably more chronic conditions, I wonder if we are ready for what, more than an epidemic, is really a demographic tsunami. And what we are just starting to see now is the shore recede and feeding this tidal wave that is coming to hit us big time.
Malcolm Maxwell.
Thank you. I was struck by Dr. Chan's comments about his work and experience as a rural family physician. The system that we work in, that rural family physicians work in, is one that we designed about 50 years ago to solve a different set of problems. And oddly enough, a system that was designed for different problems doesn't always work well for the problems we have today. We designed a system 50 years ago to prevent families from being bankrupted by sudden injury or catastrophic illness, and the model was that an event occurred, one sought medical or hospital help, the best that was available was provided, recovery hopefully occurred, and one moved on to the next phase of life. Chronic disease, it seems to me, is very different from that. We are dealing with people who will live with usually multiple illnesses, and not for a few months, but for perhaps several decades.
Well, thank you. I'd first like to begin by explaining why somebody from the world of cancer is even at this table today, because if this round table had occurred 20 years ago, there wouldn't have been a need for somebody representing cancer to be here. But the reality is that cancer is not only common, but increasingly it's becoming a chronic disease. And we've seen a really dramatic improvement in survival rates in the last 20 years. So that today we can expect over 80% of women with breast cancer and men with prostate cancer, for example, to live more than 5 years. Survival rates for colorectal cancer have also improved. And so increasingly, the paradigm of cancer control has shifted from that of being an acute disease and a lot of focus on acute episodes of care to the chronic disease paradigm.
Thank you, Steve. Thank you. Stefan invited me a number of months ago to this session, and I signed up immediately just to be part of this wonderful table where, as a CEO, I get to learn every day, so I'm pleased to be here with my colleagues. I'm going to talk to you today about what we see as LHINs, what we're doing, and the need for a value shift, a discussion about value. You've heard the statistics, and in our region, in Erie St. Clair, for those of you that aren't familiar with Ontario, we're the real Southwest Ontario. We started Chatham and move on down. Our population demographics are older than the average of Ontario, and they're growing. But what's interesting, our 24 to 44 age bracket is disappearing. It's declining because of the automotive sector. People are moving away. That leaves our seniors alone, more dependent on a system that we currently don't have. In our stats, we also see greater obesity, secondhand smoke, drinking, rheumatism, and arthritis, all precursors. What's interesting, though, in our region, when we self-report, when asked to self-report,